Good day everyone, we are the Group 4 of BSN Level 3 Block 7 and we are assigned to discuss the Unit E which pertains to the cognitive perceptual patterns or responses to altered visual function, specifically in terms of the eye trauma, the intraocular disorders, and the retinal disorders. For this slide, we have the members of the Group 4 starting with Miss CORREA, Miss DAKAY, Mr. Diego, Mr. LALOG, Miss MANGALONZO, Miss MARANAN, Mr. PALACIO, Mr. PUEDIVAN, and lastly, Miss TRINIDAD. Proceeding with the topic outlines, we have the introduction, the learning objectives, and continuing with the cognitive perceptual patterns and responses to altered visual functions in terms of, first, the eye trauma, whereas we have the subtopics of orbital and ocular trauma. Second is the intraocular disorders, specifically the glaucoma and cataracts. Third is the retinal disorders. We have here is the retinal detachment and diabetic retinopathy. And we also have the age-related macular degeneration, after which is the conclusion, and lastly is the reference page. For the introduction, when injuries or issues affect the eye or diseases that impacts the back of the eye may cause vision disturbances, whereas our brains must adapt to this reality. Whereas it is crucial for us to grasp these patterns of thought and perception in relation to vision for reason. So it is important for us to take note that any vision problems may typically develop over time, particularly in the initial phases. So individuals who understands the warning signs and symptoms of impaired visual abilities can identify such emerging issues, or they may also obtain yung expert help immediately, whereas yung pagkakaroon ng prompt identification may enable therapies that can delay the development and reduce the eyesight loss that can impaired each individuals. So we may consider such risk factors or variables for loss of vision such as yung ages, heredity, nutrition, and cigarette usage. This allows people para makapag-decide sila on more educated lifestyle decision such as eliminating yung cigarette smoking and establishing a healthy living that can substantially minimize or delay the development of visual impairments, as having a confirmation of abnormal visual function may appear alarming and it can be applicable to every individual. And with that, for the learning objectives, at the end of the topic discussion, the viewers or the students are expected to first is to define and explain the concept of cognitive perceptual patterns and responses to altered visual function, specifically in the eye trauma, the intraocular disorders, and the retinal disorders. Second is to identify and describe the responses to altered visual function in eye trauma, focusing on the orbital and ocular trauma. Next is we have to recognize the responses to altered visual function in intraocular disorders, centering on the glaucoma and cataracts. Next is to determine and characterize the cognitive perceptual patterns to altered visual function, particularly the retinal detachment, the diabetic retinopathy, and age-related macular degeneration. Then, we shall analyze the etiology and clinical manifestations of the given altered visual function. Next is to provide the appropriate management to render and improve the patient quality of life. Then, we also have to indicate and explain the applicable diagnostic tests and treatment procedures to address it effectively through identifying the specific needs of an individual with altered visual function. We also have to demonstrate the ability to critically assess an individual's condition in terms of cognitive perceptual patterns or responses to altered visual function. We also have to understand the importance of health teaching to prevent further complications in relation to the given disorders. And lastly, we must outline the key components necessary for safety measures and tailoring of relevant interventions to manage the patient condition effectively.
So, eye trauma, it is cause of vision impairment and blindness sa ating pasyente. It can be minor or severe. It can affect any part of the eye, including the eyelids, conjunctiva, cornea, sclera, iris, retina, and optic nerve, and also the surrounding of orbital structure of the eye. Trauma can be a bruise, fracture, or area of the eye. Several factor kapag nagkakaroon tayo ng eye trauma. It could be accident, chemical exposure, or foreign object entering in our eye. Yung eye trauma can result in pain, discomfort, and potential lead to temporary or permanent vision impairment of a patient. Immediate medical attention is often necessary to assess to treat eye trauma. So, here we are para i-discuss yung iba't ibang klaseng eye trauma at kung paano nga ba manage at kung ano yung pharmacological management na ginagawa pag merong eye trauma ang ating patient.
Hello everyone. Today, I will tackle about orbital trauma, which refers to injuries to the eye socket. This area includes the bones surrounding the eyeball, muscles, nerves, blood vessels, and other tissues. Yung mga cause nito ay motor vehicle accidents like yung mga high-impact crashes, falls from significant heights or even lower heights, especially sa mga hard surface, can cause significant orbital trauma, particularly sa older adult. Physical assault involving punches or kicks. Ang severity nito depends on the force and sa object used. Sports like football, basketball, hockey, and boxing. Direct hits from the ball or elbows can cause trauma. Work-related injuries like construction, manufacturing, and other heavy machinery industries pose risk from flying debris or falling objects. Yung other cause nito is penetrating injuries from sharp objects, gunshot wound, and blast injuries can even cause orbital trauma. So, for clinical manifestations, the symptoms of orbital trauma can vary widely depending on the severity and nature of the injury. So, number 1, pain and swelling. Immediate severe pain, swelling, and brushing around the eye. Number 2, visual disturbances like blurred vision, double vision, or loss of vision. Number 3, deformities such as visible deformity around the eye or displacement of the eyeball. Bleeding, subconjunctival hemorrhage, bleeding from the nose or mouth, or hypema. Number 4, mobility issues, restricted eye movement due to muscle entrapment or nerve damage. Lastly is the neurological symptoms, numbness in the cheek, forehead, or upper lip if nerves are affected. So, for diagnostic test and clinical procedure, accurate diagnosis involves a multifaceted approach, includes clinical examination. First dito is history taking because we need to understand the mechanism of injury and symptoms. Second is physical examination, includes inspection, palpation, assessment of eye movements, and visual acuity. Second is imaging studies like CT scan for primary imaging modality in assessing bony structures and detecting fractures. MRI, superior for examining soft tissue injuries and optic nerve involvement. Last is X-rays, helpful in emergency settings for large fractures or foreign bodies through less detail. So for ophthalmologic examination naman is slit lamp examination. This evaluates the anterior segment of the eye for foreign bodies or lacerations. Next is fundoscopy to assess the retinal and optic nerve health. Intraocular pressure measurement. This identifies elevation that might suggest traumatic glaucoma. So for treatment procedures, treatment is tailored to the injury severity. So first dito is close reduction. Is a non-surgical realignment of fractured bones. Second is open reduction and internal fixation. Is a surgical alignment with plates and screws. Debridement is removal of foreign bodies or damaged tissues. Reconstructive surgery is restoring normal appearance and functions. Management. For nursing management, this includes elevating the head to reduce swelling, applying cold compress, monitoring for increased intraocular pressure, and providing emotional support. For medical management, medications like analgesics for pain relief, antibiotics to prevent infection, corticosteroid to reduce inflammation, and for specific treatments includes antiemetics for nausea, and anti-glaucoma medication if increased intraocular pressure is detected. For surgical management, this includes orbital fracture repair, cantotomy, and cantolysis to relieve pressure. Advanced techniques like reconstructive and endoscopic surgeries for minimal recovery time and reduce scarring. So for pharmacological management, this includes medication like NSAIDs for pain and inflammation, topical antibiotics for preventing infections.
So, ocular trauma, leading cause of blindness among children and young adults. Usually, na part na mata na na-damage ng ocular trauma is yung muscles ng mata, and yung conjunctiva, cornea, lens, iris, pupil, sclera, retina, muscular, and also optic nerves. And ang etiology ng ocular trauma is yung blunt force from trauma, which is yung pulse and physical assault. Usually, ang tao once na nahulog sa isang mataas na lugar and mauna yung ulo, magkakakosto ng bruises and pasa. And possible na magkaroon siya ng ocular trauma and mag-cause ng loss of vision. And also, physical fight like punches, kicks, or blows sa upper part ng katawan natin. Kasi serious injuries, depend on force, and object involved may cause ocular trauma sa tao. Next is yung penetrating injuries like sharp object and glass. Sharp object like knives, screwdrivers, or broken glass can pierce the eye socket, causing serious damage to the bone, muscles, and nerves. Next is yung chemical exposure ng mata sa mga solid, liquid, powder, or aerosol chemical at home like soap, disinfectants, solvent, cosmetic drain cleaners, oven cleaners, ammonia, and one of the usual na chemical is yung bleach. Usually kasi yung bleach ginagamit natin panlinis. And masama ito para sa mata natin kasi madadamage niya yung pinakamata natin and possible sa loss of vision. Next is yung mga foreign bodies entering sa eyes natin. Yung tinatawag natin na napupuwing tayo, usually ginagawa natin, kinakamot natin nirarob natin yung mata natin kasi nga napuwing tayo kung tawagin. And minsan pa nga pinapablow sa kasama natin, which is yung very no po yun. Kasi mas possible po na ma-irritate yung mata natin sa pag-sketch natin ng mata and also sa pag-blow ng mata natin. Next is yung sport-related accident. Usually sa mga athlete, nagkakabanggaan yan, katulad sa basketball. So, once na matamaan yung part ng mata, maaari tayong magkaroon ng ocular trauma. Next is workplace incident. As a workplace incident, usually yan sa mga construction worker na kakaroon din ng pamumuwing sa mata during the work. And yung natatamaan sila sa head like hindi sinasadyang aksidente. Etiology na yun is possible na, yung mga sinabi kong etiology is possible na mag-cause ng ocular trauma sa mga tao. Clinical manifestation ng eye trauma. So, first, yung foreign body sensation. Yung usually na nakakaramdam tayo ng puwing, yung parang ang sakit-sakit na parang merong nakalagay sa mata natin and pinapablow pa natin o kaya nirarab natin, yun yung one of the first clinical manifestation ng ocular trauma. Also yung pain in the eyes. Pain in around the affected eye is common symptom. It can range from mild discomfort to severe and sharp pain. Next, yung redness. The eye may appear red or bloodshot, which can be sign of irritation, inflammation, or bleeding. Next, clinical manifestation is yung double vision or diplopia. Double vision can result from eye misalignment due to trauma or injury to the muscles. Next is eyelid swelling and bruise. Swelling and bruising of the eyelids can occur in the cases of direct trauma to the eyelid. Next is difficulty moving of the eye. Impaired eye movement can occur due to muscle damage or nerve injury. Last is yung abnormal pupil size or shape. Differences in pupil size or shape known as aniscoria or irregular pupil may indicate nerve damage or other eye injury. Yung diagnostic test and treatment procedure po for those patient na may ocular trauma. So, sa diagnostic test, dito malalaman kung anong klaseng eye injury involve yung patient by checking eye thoroughly test and seeing an eye specialist. First, nilagay ko dito yung history taking. Nilagay ko kasi siya para malaman natin kung anong klaseng injury ba ang nangyari sa patient bago siya dalhin sa ospital. Maaari natin siya tanungin kung what, when, where, and how the injury occurred para ma-identify yung risk and other concurrent injuries ni patient. And also, pwede natin itanong yung kung nakasuot ba si patient ng protective eyewear like goggles during the incident. And also, if anong klaseng object ba yung tumama sa patient or pumasok sa mata ng patient. If wood ba ito or glass. Next is the physical assessment. First inspection ng eyelid, if may edema ba ito or pamamaga, and also yung observe yung eye natin, and also assess for any laceration, identify gross trauma to the sclera, iris, and cornea. Identify also gross invisible foreign object dun sa mismong mata ni patient, and also not for sclera and conjunctival, redness, laceration, tearing, and also assess for extraocular movement, all 6 direction bilaterally, and also assess for the pupil size, equality, shape, and direct consequential response to the light. Rin dito yung palpation. Gently palpate yung eye surrounding area for pain or tenderness and obviously traumatized lobe of the eye. And also assess for anesthesia caused by the damage to supraorbital nerves, and also palpate for tenderness, crepitus, depression, or frontal bone structure. Next is yung diagnostic imaging. Included dito yung CT scan, which is makikita dito kung meron bang bone structure na nadamay during the incident. And also, it show detailed picture of the bone around the eye, sinuses, and soft tissue, helping to find even small fracture or things stuck in the eye. Next is yung MRI or yung magnetic resonance imaging. MRI kasi better siya sa CT scan for looking at soft tissue injury like muscles damage problem with the optic nerve and blood clot in the eye area. It also used when the doctor need to check for possible damage to the optic nerve or sa mga soft tissue. So, okay din yung MRI than CT scan. So, next is yung ophthalmologic examination. Kasama dito yung visual acuity. Yung losing visual acuity can greatly affect a person's quality of life and vision loss result from eye disease. Next, yung direct ophthalmoscopy. This examination is a handheld instrument with various plus and minus lenses. Next is the indirect ophthalmoscopy. This process naman use bright and intense light, and the instrument itself is affixed with a pair of binocular lenses which are mounted on the examiner's head. This instrument enables patient to see larger area of the retina. Next is yung slit lamp examination. It is a binocular microscope and used to examine the eye with magnification of 4 to 10 times real image. Next yung color vision testing, which is important para malaman if yung eye ba is nakakakita pa ng iba't ibang kulay. It's used to assess person's ability to distinguish between different color. Next is yung Amsler grid. Yung Amsler grid, tool siya used during eye exam to find visual distortion and problem with the central vision, often linked to condition like macular degeneration. It shows straight line crossing horizontally and vertically with the dot at the center. Next is yung ultrasonography. This medical imaging technique that use sound wave. Pero yung ultrasonography can be used to identify orbital tumors, retinal detachment, and changes in tissue composition. Next is yung color fundus photography. Fundus photography is a technique used to detect and document retinal lesion, and also the patient pupils are widely dilated during this procedure. Fluorescent angiography. Yung fluorescent angiography evaluate clinical significant macular edema, document macular capillary or non-perfusion, and identify retinal and choroidal neovascularization. Yung yung tonometry. Tonometry measure IOP by determining the amount of force necessary to indent or flatten a small anterior area of the globe of the eye. Last is the gonioscopy. Yung gonioscopy visualize the angle of the anterior chamber to identify abnormalities in appearance and measurement of the eye. So, sa treatment procedure naman, included dito yung antibiotics or anti-prodrug depending on the nature of injury, topical or oral antibiotic or anti-prodrug medication, eye irrigation in case of chemical exposure or burn immediately, and thorough eye irrigation with saline or special eye wash. Next is yung foreign body removal, which is yung nire-remove dito yung mga dust, metal or debris sa mata natin. Next yung pain management. Pain relief may be necessary and over-the-counter or prescription pain medication can be used ng mga patient natin. Next is yung eye patches or shield. For certain injury lang yung eye patches and shield. So, next is the surgery. Severe eye injuries such as globe rupture, retinal detachment, or intraocular foreign bodies may necessary for surgical intervention. Last is the vision rehabilitation. In case of permanent vision loss or visual impairment resulting from trauma, vision rehabilitating program may be recommended to help patient adapt to their new visual status. So for the management to the patient with ocular trauma, first the nursing management. It immediate nursing care prioritizing stabilizing the patient, managing pain, and preventing additional injury. First dito yung applying cold compress to the injured area. Cold compress kasi ay nakakatulong to reduce yung pain and swelling sa affected area. And it's constricting blood vessel which decrease blood flow to the affected tissue. Next is applying eye drop. This drop could include antibiotics to prevent infections and steroid to reduce inflammation, or lubricant the eye to keep the eye moist and comfortable. It is essential to use eye drop exactly as directed to ensure optimal healing and prevent complication. Next is assist with an administration of medication as needed. This direct-acting topical miotic drug causes pupillary constriction, facilitating the outflow of aqueous humor and lowering IOP. Next, nursing management is yung monitoring for increased eye pressure or vision change. High eye pressure can damage the optic nerve and cause permanent vision loss if not treated quickly. Keeping an eye on the signs help catch and address problem early. Next is yung provide emotional support sa patient natin merong ocular trauma. Eye injury can be very upsetting sa mga patient na may ocular trauma. So need natin mag-offer ng emotional support, reduce anxiety, and help the patient to feel safe and cared po. Management naman, this involve medication to manage symptoms and prevent complications sa mga patient nating may ocular trauma. First, pwede natin i-assist sila na mag-drink ng pain management, give analgesic for pain relief. Pain management is critical to patient comfort and can help reduce stress and promote healing sa mga pasyente natin. Next, yung mga infection prevention, like yung apply antibiotic or eye drop or ointment to prevent bacterial infection, kung ano man yung prescribed ng doctor sa patient natin. Next, yung mga drugs na anti-inflammatory treatment. Use steroid eye drops to reduce inflammation and swelling and also monitor for potential side effect of steroid use. Effective medical management involve prompt and comprehensive care to address the immediate injury, prevent complication, and support sa patient recovery na. Next is the surgical management. Surgical management for ocular trauma involves various procedures aiming at repairing and restoring eye function from following injuries. First is yung repairing corneal and scleral laceration. It involves stitching them up during surgery to close tear or cuts in this part of the eye. This restore the eye's outer structure to prevent infection and protect vision. Next is yung removal of foreign body, surgical extraction of object embedded in the eye to prevent infection and further damage. Next is the orbital fractures repair. This surgical realignment and stabilization of broken bones around the eye to restore normal anatomy and function. Next is yung birectomy. It is removal of vitreous gel from the eye to address internal bleeding or clear debris. Next is the retinal detachment repair. This surgical technique like pneumatic retinopexy or birectomy to reattach the retina and prevent vision loss. Next is the globe rupture repair. An emergency surgery to close yung rupture ng eyeball and restore its structural integrity. Next is the cataract surgery. It is the removal of traumatic cataract and placement of artificial lenses to restore the vision of the patient. Last is the eyelid reconstruction. It is repair or reconstruction of damaged eyelid to protect the eye and improve function. Next, management is the pharmacological management. It's in ocular trauma involve the use of medication to elevate symptom, prevent complication, and promote healing. First, sinabi ko nga is pwede tayo magbigay ng analgesic sa tao, sa patient nating may ocular trauma to pain relief medication. It is to pain relief medication to manage discomfort and improve patient comfort. Next is the antibiotic. Antibiotic to prevent or treat infection, especially in case of open wound or penetrating injury in the eye area. Next is the corticosteroid, anti-inflammatory drug to reduce swelling and inflammation which can help minimize the tissue damage and promote healing po sa eye area ng patient. Next is yung myodratics, eye drop that dilate pupils and relax the eye muscle, often used to reduce pain and prevent complication. Next is yung anti-glaucoma medication. These drugs such as beta blocker, alpha agonist, or carbonic anhydrase inhibitor to lower intraocular pressure, particularly in cases where trauma may affect drainage of fluid from the eye. Last is the artificial tears or yung sa lubricant ng eye natin to moist our eye. Eye drop or ointment to relieve dryness, smoothness, irritation, and promote healing of corneal abrasion or surface injury. This medication are prescribed based on the specific needs po ng patient and condition of the patient, aiming to optimize recovery, prevent complication, and preserve vision following ocular.
So, for the introduction of intraocular disorder, this refers to conditions that affect the structure within the eye, such as the retina, cornea, iris, lens, and optic nerve. These disorders can vary widely in their severity and symptoms, ranging from minor irritation to vision-threatening conditions. So, some common intraocular disorders includes this. Number 1 is the glaucoma. So, glaucoma is a group of eye condition that damage the optic nerve, often due to increased pressure within the eye. So, if left untreated, glaucoma can lead to irreversible vision loss. The next one is the cataracts. So, this is an clouding of the eye's natural lens, which typically occurs with aging but can also be caused by injury, medications, or other medical conditions. So, cataracts can cause blurred vision and eventually lead to blindness if not treated with surgery. The next one is the age-related macular degeneration or the AMD. This is a progressive condition affecting the macula, the central part of the retina responsible for sharp central vision. And AMD can cause central vision loss, making it difficult to read, drive, or recognize faces. And then the next one is the diabetic retinopathy. So this is a complication of diabetes that damage the blood vessels in the retina. It can also lead to vision loss if left untreated. So particularly in advanced stages when abnormal blood vessels grow on the retina surface. And then the next one is the retinal detachment. So this is when the retina detaches from the back of the eye, leading to vision loss. It often presents as flashes of lights, floaters, or a curtain-like shadow in the field of vision and requires immediate medical attention. And then the next one is the retinitis pigmentosa. So this is a group of genetic disorders that cause the degeneration of the retina's light-sensitive cells or the rods and cones. So leading to night blindness and a gradual loss of peripheral vision. And then the uveitis. So this is a inflammation of the uvea, the middle layer of the eye, comprising the iris, ciliary body, and choroid. So uveitis can cause eye pain, redness, light sensitivity, and blurred vision. And then the last one is the keratitis. So this is an inflammation of the cornea. So often due to infection, injury, or wearing contact lenses for an extended period. It can cause eye pain, redness, blurred vision, and sensitivity to light. So these are just few examples of the many intraocular disorders that can affect vision and eye health. So prompt diagnosis and appropriate treatment are essential for managing this condition and preserving vision. So regular eye exams are crucial for detecting intraocular disorder early, especially since one of them may not present symptoms in their initial stages. And that would be all for the introduction po.
Cause ng glaucoma is still unknown, but ang pinakabinabantayan dito is yung pag-increase ng ocular pressure or ng IOP, na which is ito yung nakakapag-progress ng condition. So, kaya ang pinaka-target na medication here is yung ma-prevent yung pag-increase ng IOP. Ang etiology or ang mga key risk factors ng glaucoma is of course first is yung pag-increase ng internal eye pressure. At the same time, very prominent ito usually sa mga older adults over the age of 55 years old, na commonly sa mga Black, Asian, or Hispanic cultures. Moreover, from rin ito sa mga may family history ng glaucoma and yung may mga medical conditions such as diabetes, may migraines, may high blood pressure, and yung may mga sickle cell anemia. Nagkakasyon nito sa may mga maninipis or maliliit na cornea sa kanilang mata at yung may mga extreme nearsightedness or farsightedness. And of course, very eligible ang mga may eye injury or certain types of eye surgery. And lastly is yung may mga matagal na nagtitake ng corticosteroid medicine, like for example is yung eye drops. Ayan, so ang mga clinical manifestations ng glaucoma or yung tinatawag rin na silent thief of vision because the majority of the patients here are unaware of their condition. So unknowingly, they remain unaware of the disease na nangyayari sa kanila until nagkakaroon na ng changes or nanonotice na yung changes doon sa kanilang vision. And yung pag-decrease na kanilang eyesight. So ito yung mga gradual peripheral vision, blind spot, tunnel vision, halos around lights, eye pain and headache or yung mga nausea and vomiting, and of course yung blurred vision. So the diagnostic test of glaucoma, ang ginagawa sa mga may ganito is first is diagnostic test is yung tonometry, and second is yung ophthalmoscopy, visual field testing, gonioscopy, optical coherence tomography yung tinatawag na OCT, and lastly of course yung pachymetry. So when you talk about the management, of course, first is unahin natin yung nursing management. First is yung pag-observe ng intraocular pressure and yung pag-enhance sa kanilang visual sensation perception. Second is yung pag-offer natin ng emotional assistance and some of the therapy para ma-decrease yung feelings of depression or anxiety on their end. Third is yung pagka-start natin ng patient education and ng health teachings. And of course, lastly, one of the part of our nursing management is yung pag-administer ng drugs and yung pag-offer ng mga pharmaceutical assistance. So with regards to the medical management, of course, dapat check natin yung prescription ng eye drops, yung pagkakaroon ng oral medications, and pag-modify ng lifestyle modifications, pagkakaroon ng regular eye examinations, and ang pinakamalaga is of course yung provide natin ng education and ng counseling. So, with regards to the surgical management, of course, first, ito yung mga treatment with lasers natin. Like, for example, yung ALT, yung trabeculectomy or trepanation. And second is we have iridectomy. Third is we have psychoplastic eye drops. Fourth is we have malenteno valve implant. Fifth is we have cyclocryotherapy. 6 is yung pagkakaroon ng o paggagamit ng diathermy or ng mga cyrosurgery techniques. And of course, lastly is yung pagkakaroon ng shunt na which is nakakonect sa mga aqueous and sa mga venous system. So sa pharmacological management naman natin, ito yung mga pilocarpine hydrochloride, triamcinolone maleate, acetazolamide or Diamox na prescription. Fourth is yung mga carbonic anhydrase inhibitors natin such as yung mga acetazolamide or yung Diamox. And of course, last is yung mga Diabetic or yung mga Propane and yung mga Primomentin. Treatment procedures, ang first natin dito is of course yung medication therapy, laser therapy, mga ating surgical interventions, mga micro-invasive procedures, and of course, lastly, yung pagkakaroon ng regular monitoring and follow-up na which is one of the essential things na pinakamalagang nangyayari sa mga may patient na glaucoma.
Good day everyone, I am Hans Christian LALOG and I'm going to discuss further a specific common ocular disorder which is cataracts. The most common etiology in developing cataracts is senile cataracts or known as age-related cataracts starting 80 years of age. Other contributing factors such as infection, long-term use corticosteroids, smoking, alcohol intake, blunt trauma, exposure of UV light rays, ocular conditions, and systemic conditions like diabetes. Let's proceed on the clinical manifestations of cataracts. The initial sign and symptoms of cataracts is blurred vision because of the formation of cloudy image or may fog dun sa mata nila. Minsan halo ang kanilang nakikita, myopia shift or nearsighted, diplopia or double vision, light scattering due to reduced contrast sensitivity and visual acuity, astigmatism, and color vision changes because of the proteins clumps together that gives a tint na brown or yellow ang kanilang nakikita. For the diagnostic findings, we have the Stellan chart sa mga may katarata, may reduced visual acuity, ophthalmoscope, and slit lamp biomicroscopy. Dito na ipapakita meron silang abnormal red reflex which is meron silang dark sa affected eye area and meron makikita na fog na doon sa kanilang lens which indicates the maturity of their catarata. For management of cataracts, we have palliative and surgical management only. For the palliative management, patient use eyewear prescription para ma-improve ang kanyang visual acuity kahit papaano, binibigyan ng magnified reading glasses para makatulong sa nearsightedness at pagsuot ng sunglasses sa labas to reduce light sensitivity. For the surgical management, meron tayong phacoemulsion kung saan yung portion of anterior capsule ay tinatanggal, allowing extraction of lens nucleus and cortex while posterior and zonular support are left intact. Next is iridectomy known as laser surgery, draining of aqueous humor in reducing intraocular pressure. We have cryo-extraction kung saan yung catarata lifted from the eye using a small probe that has been cooled temperature and adheres to wet surface of the lens. Next, we have the lens replacement which has three types. We have aphakic glasses that receives 25% magnification, contact lenses na kailangan tanggalin ito occasionally lalo na bago matulog para maiwas ang infection, and the implantation of intraocular lenses, but these are contraindicated to such conditions such as uveitis, retinopathy, glaucoma, and rubeosis iridis. For the nursing management, meron tayong preoperative and postoperative procedures. Sa preoperative, kailangan natin ma-obtain yung mga lab results tulad ng CBC, ECG, reanalysis, that is case-to-case basis sa ating pasyente. Take note natin kung meron siyang history of alpha antagonist dahil ito ay pwedeng mag-increase ng chance of developing meiosis and iris prolapse. And then we can administer dilating drops prior to the surgery tulad ng mydriatic, para makonstrict yung iris dilator muscle, tropicamide, anticholinergic, and anti-anxiety medications. For the post-operative care, health teaching is stressed out. Katulad ng turuan natin sila paano maglinis ng operated eye, gamitin ng clean tissue from inner to outer canthus. Ngayon, kung masakit na after surgery, uminom sila ng NSAIDs. And then, wag silang matutulog doon sa operated part. At kailangan silang maging adherent sa kanilang medication, usually NSAIDs, corticosteroids. And then, kapag sila isang driver, optimal na mag-drive na lang sila in daylight at iwasan ng mag-drive sa gabi.
And so for the retinal disorders, the retina plays a vital role in the visual system by converting light into neural signals that the brain interprets for visual images. Retinal disorders have a significant impact on the vision and if left untreated can lead to blindness. Common retinal ailments encompass diabetic retinopathy, age-related macular degeneration or AMD, retinal detachment, and retinitis pigmentosa. Factors such as diabetes, aging, and genetic abnormalities and trauma can contribute to the development of these conditions. Early detection and treatment are crucial in order to prevent vision loss and maintain a good quality of life, and a comprehensive understanding of various retinal illness, risk factors, and available treatment options is imperative for delivering appropriate eye care. Ayan, so for the retinal detachment, it is characterized by the separation of retinal pigment epithelium from the neurosensory layer. The four types of retinal detachment include rhegmatogenous, tractional, combined rhegmatogenous and tractional, and exudative. Rhegmatogenous retinal detachment is the most prevalent form. This condition occurs when a hole or a tear forms in the sensory retina, allowing vitreous fluid to pass through and detach it from the retinal pigment epithelium. Patients can experience both rhegmatogenous and tractional retinal detachment simultaneously. Exudative retinal detachment, on the other hand, results from the accumulation of serous fluid beneath the retina originating from the correa. Conditions such as uveitis and muscular degeneration can lead to the production of this serous fluid. For the etiology, traction retinal detachment occurs due to a filling pores or a tension on the retina. An ophthalmologist must identify all areas of retinal breakage and release the scars of fibrous brands that are causing the traction on the retina. Typically, patients with this condition have developed fibrous scar tissue from conditions such as diabetic retinopathy, vitreous hemorrhage, or retinopathy of prematurity. The hemorrhages and fibrous proliferation associated with these conditions exert a pulling force on the delicate retinal tissue. Individuals at risk for this type of detachment include those with high myopia or those who have aphakia, which is the absence of natural lens following a cataract surgery. Trauma can also contribute to the development of the hematogenous retinal detachment. Additionally, between 5 to 10% of all cases of hematogenous retinal detachment are associated with proliferative retinopathy, which is a condition linked to a diabetic neovascularization. For the clinical manifestations, patients may describe experiencing a shade or a curtain passing through or across the vision of one eye, seeing cobwebs, noticing bright flashing lights, or suddenly perceiving a large number of floaters. Although patients typically do not report pain, retinal detachment constitutes an ocular emergency necessitating prompt surgical interventions for optimal outcomes. Assessment and diagnostics following the determination of a visual acuity, it is imperative to conduct a dilated fundus examination utilizing an indirect ophthalmoscope along with slit lamp biomicroscopy. Serifundus photography and fluorescein angiography are frequently employed during the evaluation process. Furthermore, optical coherence tomography and ultrasound are increasingly utilized for comprehensive retinal assessment, particularly in cases where the view is obstructed by a dense cataract or vitreal hemorrhage. It is imperative to identify all retinal breaks, fibrous bands potentially causing traction on the retina, and any degenerative changes present. For the treatment and procedures in cases of rhegmatogenous retinal detachment, surgical interventions aim to reattach the sensory retina to the retinal pigment epithelium. In tractional retinal detachment, it is imperative to eliminate the source of traction and reattach the sensory retina. The predominant surgical approaches utilized for these purposes are scleral buccal and vitrectomy procedures. In the scleral buccal, the retinal surgeon applies pressure to the sclera, typically using a scleral buckle or a silicone band to indent the scleral wall externally. This action aims to bring the two layers of retina into contact with each other. For the vitrectomy, a vitrectomy is an intraocular procedure facilitating the introduction of light source through one incision, while the second incision serves as a portal for the vitrectomy instrument. During this procedure, the surgeon dissects pre-retinal membranes under direct visualization with the retina stabilized by intraoperative vitreous substitute. Vitrectomy can alleviate traction on the retina and may be combined with scleral buckling to address the retinal detachments. To assist in reattaching the sensory retina to the retinal pigment epithelium, substances such as the gas bubble, silicone oil, or perfluorocarbon and liquids may be injected to the vitreous cavity. For the management, first is the nursing management. Here we have health education, which the nurses educate the patients on retinal detachments, its causes, symptoms, and the importance of prompt treatment. This includes informing them about the associated risk factors like high myopia, aphakia, post-cataract surgery, and trauma. Next is providing supportive care, which the nurses offer comprehensive support care ensuring the patient comfort, addressing concerns, and providing emotional support throughout the management process. Next is the medical management. So first is under this is the assessment which the nurses meticulously assess the visual acuity. This focuses on the thorough the thorough identification of retinal breaks, fibrous bands causing traction and degenerative alteration, thereby informing precise treatment and modalities. Next is the diagnostic procedures. Dilated fundus examinations, little microscopy, and advanced imaging modalities such as optical coherence, tomography, and ultrasound. Next is the surgical management. Under this is the scleral buccal and the vitrectomy, which I discussed earlier. And lastly is the pharmacological management. Under this, management involves the administration of medications to address underlying conditions contributing to retinal detachment, such as diabetic retinopathy and uveitis.
Now let's talk about diabetic retinopathy. Diabetic retinopathy is a serious eye condition and the leading cause of blindness in people with diabetes. So it affects the retina, the light-sensitive tissue at the back of the eye that converts light into signals for the brain to interpret as vision. So chronic high blood sugar levels damage the blood vessels in the retina, setting off a series of events that can eventually lead to vision loss. So now let's proceed to the etiology or the causes of the diabetic retinopathy. So the exact cause of this disease is unknown, but high blood sugar is the main factor. So chronic high blood sugar levels cause the small blood vessels in the retina to weaken and leak fluid. So this leakage can cause the retina to swell and impair vision. So additionally, the damaged blood vessels may become blocked, depriving the retina of oxygen and nutrients. So in response of the retina to the lack of oxygen, the retina triggers the growth of the new abnormal blood vessels, or called as neovascularization. So these fragile vessels can lead into the vitreous cavity, further impairing vision. For the signs and symptoms ng diabetic retinopathy, so it often progresses without noticeable symptoms in the early stage, making it a silent threat to our sense of sight. So as the condition worsens, individuals may experience blurred vision, seeing floaters such as dark spots or cobwebs, distorted vision, so straight lines may appear wavy sa kanila, difficulty seeing colors, and of course, sudden vision loss. So, for the diagnostic procedure, so early detection ng diabetic retinopathy is vital for preventing vision loss. So, a comprehensive eye examination for people with diabetes typically includes, first, we have the dilated eye exam. So, eye drops are used to widen the pupils, allowing for a thorough examination of the retina and blood vessels for the signs of damage. We also have fluorescein angiography. So this test involves injecting a special dye in the bloodstream and taking photographs of the retina as the dye circulates. So it helps identifying leaks from blood-damaged blood vessels. We also have the optical coherence tomography. So this imaging technique uses light waves to create a detailed cross-sectional images of the retina, helping diagnose swelling and other abnormalities. Now let's talk about treatment. So treatment option for diabetic retinopathy depends on the severity of the condition. So sa mga early stages, controlling blood sugar levels is critical. Pero here are some other treatment options for the advanced stages. So first we have laser therapy or photocoagulation. So under it we have the focal grid laser treatment. So this is used to treat macular edema. Small laser burns are applied directly into the leaky areas around the macula to seal bleeding blood vessels and to reduce the swelling. We also have pan-retinal photocoagulation. It is used to treat proliferative diabetic retinopathy by applying laser burns to the peripheral retina, so creating scars. These scars reduce the retina's oxygen demand, decreasing the time for neovascularization and preventing the growth of new abnormal blood vessels. We also have antivascular endothelial growth factor injection. So, antivascular endothelial growth factor is a protein that stimulates the growth of new blood vessels. So, high levels of VEGF in diabetic retinopathy promotes the formation of abnormal leaky blood vessels.
So anti-VEGF drugs reduce VEGF activity, thereby decreasing neovascularization and vascular leakage. So yung mga common medication include Lucentis, Avastin, and CORREA. So these medications are injected directly into the vitreous fluid of the eye. So for the administration of this drug, it is typically administered monthly at first, with frequently gradually decreasing based on the patient's response to the treatment. So we also have vitrectomy. So it is a surgical procedure recommended for advanced proliferative diabetic retinopathy, especially when there is a significant vitreous hemorrhage or bleeding into the vitreous gel, or fractional retinal detachment. So, dito yung retina is being pulled by the scar tissue. So, vitrectomy involves removing of the vitreous gel containing blood or debris and replacing it with a clear solution to improve vision. So, scar tissue from the retina is also removed during the procedure to reduce traction. So, after surgery, patient may need to maintain a specific head position for several days para ma-ensure yung proper healing ng retinal detachment. Now, for the management of the diabetic retinopathy, it requires a comprehensive approach. So first, let's talk about medical management. So under it, we have blood sugar control. So maintaining blood glucose levels within a target range is crucial. So this can be achieved through a combination of dietary changes, regular physical activity, and adherence to the prescribed diabetes medication or insulin therapy. We also have regular monitoring. So patients should regularly monitor their blood glucose levels using a glucometer and undergo periodic HbA1c testing to assess long-term blood sugar control. So we also have blood pressure and cholesterol management. So controlling hypertension and cholesterol through lifestyle changes and medications reduces the risk of retinal damage. So for pharmacological management, we have the anti-VEGF injection. So as I talked about regarding sa possible treatment, as nabanggit ko na rin yung mga samples ng drugs. So these are the primary pharmacological treatment for diabetic macular edema and proliferative diabetic retinopathy. So they help in reducing retinal swelling and inhibit the growth of the abnormal blood vessels. We also have corticosteroids. So in some cases, intravitreal corticosteroids like triamcinolone, acetylcholine, or dexamethasone implants are used to reduce inflammation and macular edema. However, these treatments carry risks such as cataracts formation and increased intraocular pressure. So we also have systemic medications, so medications for controlling blood pressure. Cholesterol and blood sugar levels play an indirect but vital role in managing diabetic retinopathy by addressing the underlying risk factors. For the surgical management, we have laser coagulation. So this is a cornerstone treatment for both diabetic macular edema and proliferative diabetic retinopathy. So it effectively stabilizes vision and prevents further vision loss. We also have vitrectomy. So this is a surgical intervention and is essential for patients with severe complications like vitreous hemorrhage or fractional retinal detachment. So it can significantly improve vision and prevent further retinal damage. So for some cases, we have combined procedure. So patient may require a combination of both laser therapy and vitrectomy to achieve optimal outcomes. So for the nursing management, so we have patient education. So for health teaching, so nurses provide essential education on maintaining blood sugar control, adhering to medication regimens, and making lifestyle changes to manage diabetes effectively. They also emphasize the need for regular eye examination. We also have support and counseling. So nurses offer support and counseling to help patients cope with the diagnosis of diabetic retinopathy and its potential impact on their vision and lives. So this includes psychological support and guidance on assessing resources and support groups. We also have, of course, the monitoring and follow-up. So nurses play a critical role in scheduling and conducting regular follow-up appointments to monitor the progression of the diabetic retinopathy and the effectiveness of treatments. They also help manage any side effects or complications from the treatments. So to summarize, managing diabetic retinopathy requires a comprehensive and coordinated approach involving medical, pharmacological, surgical, and nursing intervention. So early detection through regular eye exams, stringent blood sugar control, and timely treatments can significantly reduce the risk of vision loss and improve the outcomes for patients with diabetic retinopathy.
As people age, a condition called age-related macular degeneration, or also known as AMD, can become a significant threat to their vision. So AMD specifically targets yung ating macular, which is a vital part for the retina that is responsible for our ability to see fine details in the center of our gaze. So these damages can severely impact our daily activities that rely on clear central vision, like reading text, driving safely, or distinguishing faces. Moving forward to the etiology, while the exact cause of AMD remains unknown, there are several factors that were distinguished to have an essential role in this disease. So first, the age. So it is the most significant risk factor, which is simply getting older. So AMD's prevalence rises sharply after 50, with the highest rates in those over 80 years old. Next is the genetics. A family history of AMD increases an individual's susceptibility. There are specific genes that may predispose people to this disease. Next is smoking. So smoking is a major risk factor, and quitting can help slow down AMD progression. Next is the sunlight exposure. It is believed that having excessive exposure to ultraviolet or UV light may be a factor, although the exact mechanism of this is still unclear. Then we have obesity and cardiovascular diseases. So having these conditions may be associated with an increased risk of AMD. Then, as for the diet, so a diet with a high in saturated fat and low in antioxidants, examples of this is the vitamins C and E, may increase the risk for AMD. So conversely, a diet rich in fruits and vegetables may offer protection. And lastly, we have the race. So Caucasian population appear to have a higher risk than African Americans on this disease. Next is we have the clinical manifestation. In here, we have the two types of AMD. First is the dry AMD, and second is the wet AMD. So speaking of dry AMD, this is also known as non-exudative AMD. So it is considered as the most prevalent form, affecting roughly 85% of the AMD cases, and it progresses gradually over time, causing the breakdown of light-sensitive cells, the photoreceptors, within the macula part. So indicated here is the possible symptoms. First is the blurred central vision. So it can significantly impair tasks like reading, perceiving fine details, or recognizing faces. Next is the diminished color vision. So colors may appear faded or dulled. Next, we have the metamorphopsia. So indicated here is the straight lines may appear distorted or wavy. With this symptom, it often indicates advanced dry AMD. And lastly, we have the low light vision difficulties. So individuals may experience problems seeing in poorly lit environments. So there are 3 stages of dry AMD, which slowly progresses over several years usually. First is the early stage. During the early stage of dry AMD, it does not exhibit any symptoms yet, whereas it leads us to the intermediate. So in some cases, individuals with the intermediate stage of dry AMD still do not have any observable symptoms. However, there are some that are symptomatic that experience mild symptoms, such as mild blurriness that usually occurs in the central vision or having trouble seeing things in a low lighting environment. And lastly is the late stage. So there is no known treatment for late dry AMD. It is observable to have loss of the central vision and or having blurry or wavy areas in the central vision itself. Next type is the wet AMD, the exudative AMD. So it is also known as the advanced neovascular AMD. So in this form, it is less frequent but more aggressive, affecting approximately 10 to 15% of AMD cases and considered to be always in the late stage. So it arises when abnormal blood vessels develop beneath the macula, leaking fluid and blood. So the symptoms in here appear rapidly and can be quite severe. First, we have the sudden and significant central vision loss. So the vision loss can occur quickly within days or weeks. The next, we have the central scotomas or the blind spots. So there are dark areas that appear in the center of the vision, may worsen over time. And lastly, we have the distorted vision. So it can be similar to the dry AMD, whereas the straight lines may appear wavy or distorted.
Now for our management po. So first in the nursing management po, meron po tayo dito. First is the monitoring and assessment. So regularly checking the patient's vision and recording any changes po. So this involves looking for symptoms like blurred vision, difficulties reading, or black areas in the central vision. Next po is the lifestyle and dietary guidance. So advising a diet high in leafy green vegetables, fruits, and omega-3 fatty acids. So yeah, recommending recommend also quit smoking and managing cardiovascular risk factors. Patient education po. So nurses have the vital function in informing patients about the AMD, which is which is its progression and possibilities for treatment. So it also involves counseling patients about the importance of frequent eye exams, good eating habits, and modifications to their lifestyles. Next po dito is yung the medical management. So, lifestyle modification. So, i-advise po natin yung patient to wear sunglasses while going outside for protection to the eye. Next po is yung smoking cessation. So, like po yung sinabi ko kanina, smoking is a big risk factor for AMD progression. Next po is yung pharmacological management. So, yung po PDT or the photodynamic therapy. So, like I said po kanina, this procedure includes injecting a light-sensitive medication called verteprofen or the Visidyne. This pinapasok po ito into the circulatory system and this is subsequently activated with a laser to eliminate unusual blood vessels in the eye. Next po is the anti-VEGF therapy or known as antivascular endothelial growth factor. So these medicines are frequently recommended for the AMD that it is wet. So these medications such as a drug called Lucentis, Eylea, and Avastin. So these are injected into the eye to reduce abnormal blood vessel growth and fluid leakage. So ngayon, dadaan naman po tayo sa diagnostics. So annual eye exams are crucial since macular degeneration will exhibit symptoms in its early stages. So meron po tayo dito ang dilated eye exam. So ito po, ang dilated eye exam is eye drops dilate to wide our pupil. So dito po, it will administer the drops, dilate your pupils, then utilize an exclusive lens to examine the interior of your eyes. Second po is yung fluorescein angiography. So ito po, this will inject a yellow dye called fluorescein into the vein in your arm. A specialized camera follows the dye as it follows through the blood vessels in your eye. So the photographs can reveal the leaks beneath the macula. Next po is yung optical coherence tomography or OCT. So this imaging machine captures comprehensive photographs of the back of your eye, including the retina and macula. So optical coherence tomography is neither intrusive nor painful. So you may really look through a lens while the machine captures images. Next po is yung optical coherence tomography angiography or DOCTA. So these diagnostic instruments uses laser light reflection and OCT scanning device. So this requires only a few seconds and generates 3D photos of blood in your eye. So in the possible treatment naman po, we will avoid smoking because smoking po is a significant risk factor of AMD progression. Exercise and healthy weight, so regular physical activity and maintaining a healthy weight can reduce the risk of progression. Photodynamic therapy po or PDT. This is to remove excess blood vessels in your eye. And injectable light-sensitive medication is used in conjunction with a laser. So this may mix with PDT and anti-VEGF injection. Last po is yung laser photo coagulation. So this procedure will use laser to seal and to kill the bleeding blood vessel. So this was the initial treatment for the wet AMD. Next naman po is in the surgical management. First is the laser photocoagulation. So this is primarily employed to treat wet AMD. involves the dissolution of abnormal blood vessels during the high-energy laser. So this can help prevent further vision loss, but is less commonly used due to the development of anti-VEGF therapy. Next point is the retinal translocation. So this sophisticated surgery entails relocating the macula from the injured section of the retina to the healthier one. So this is an option for some patients with severe AMD. Next and last is the vitrectomy. So in certain situations, such as when there is significant retinal bleeding or other issues, so this is carried out to remove the gel inside the vitreous and replace it with an obvious remedy.
To conclude everything, recognizing the precise disease in terms of the altered visual function enables healthcare specialists to offer the best treatment choices, which might include prescription medications, surgical procedures, or vision rehabilitation methods. Moreover, having a visual impairment can cause eye discomfort and increase the likelihood of falling, since there is a poor depth perception, whereas identifying these difficulties encourages individuals to take preventive actions that minimizes the potential problems. Overall, comprehending and acknowledging changed visual abilities has implication to fostering prompt identification, making informed choices, and achieving enhanced therapeutic results, and eventually sustaining the eyesight and an improved standard of life. Here are the reference materials used for this topic discussion. With that, thank you so much for listening, everyone. Once again, we are the Group 4, and we are assigned to discuss the cognitive-perceptual patterns or responses to altered visual function in terms of eye trauma, intraocular disorders, and retinal disorders. This is done in compliance with the final requirements in NRS 3217, Medical Surgical Nursing 2, specifically in the lecture part. Thank you so much.